Understanding aortic disease, risks and prevention. The aorta, the body's largest and most vital artery, serves as the main highway carrying oxygen-rich blood from the heart to every organ and tissue. Originating from the heart's lower left chamber, known as the left ventricle, the aorta arches in a cane-like shape, then branches out to supply blood to the brain, muscles, and other organs. When this critical vessel is compromised, the entire body's blood supply can be put at risk. This script will clarify the various conditions affecting the aorta, identify key risk factors, recognize the signs to watch for, and empower individuals with knowledge on effective prevention and management strategies. What is aortic disease? Understanding the basics. To comprehend aortic diseases, it is essential to grasp the structure of the aorta itself. The aorta consists of three distinct layers: the inner layer, known as the intima, the middle layer, or media, and the outer layer called the adventitia. The integrity of these layers is crucial for its function. Aortic diseases can be broadly categorized into two main groups: those affecting the aortic valve and those affecting the aortic wall itself. Aortic valve disease is a condition where the aortic valve, located between the left ventricle and the aorta, does not function properly. The primary role of this valve is to ensure blood flows only in the correct direction through the heart. When the valve is damaged or diseased, it can impede blood flow to the rest of the heart and body. One type of aortic valve disease is aortic valve stenosis. This condition occurs when the valve flaps, or cusps, become thick, stiff, or fused together, narrowing the valve opening and reducing or blocking blood flow from the heart into the aorta. This narrowing forces the heart to work harder to pump enough blood to the body, leading to a pressure overload that can cause the left ventricle muscle to thicken and eventually weaken. Conversely, aortic valve regurgitation occurs when the aortic valve does not close completely, allowing blood to leak backward into the left ventricle after each heartbeat. This backflow creates a volume overload for the heart, causing the heart muscle to dilate and thicken as it attempts to compensate. Beyond valve issues, aortic diseases can also affect the aortic wall itself, including aortic aneurysms and dissections. An aortic aneurysm is a localized weakened area on the aorta's wall that bulges outward like a balloon. These can form anywhere along the aorta, but are most commonly categorized by location. Abdominal aortic aneurysms (AAA) occurring in the lower part of the aorta, and thoracic aortic aneurysms (TAA) found in the chest. An aortic dissection is a life-threatening medical emergency. It happens when a tear forms in the inner layer of the aorta's wall, allowing blood to rush in and split the inner and middle layers apart. This false passage can either slow or completely block normal blood flow to organs, or lead to a catastrophic rupture of the aorta. There are two main types based on the Stanford classification system. Type A involves the ascending aorta closer to the heart and typically requires immediate emergency surgery. And Type B begins farther down the aorta and does not involve the ascending aorta. Clearly differentiating these conditions, despite their shared connection to the aorta, is crucial for public understanding of their distinct pathological mechanisms and varying degrees of urgency. Who's at risk? Identifying key factors. Many factors can raise the risk of aortic disease, with some being common across both valve and vessel wall issues. One of the most significant risk factors is chronic, uncontrolled high blood pressure, hypertension. The increased force of blood over time can weaken the aortic walls, making them more susceptible to both valve problems and the formation or growth of aneurysms and dissections. High blood pressure can even double the risk of having an aortic aneurysm and accelerate its growth. Smoking is considered the most important modifiable risk factor. Smoking dramatically increases the likelihood of developing an aortic aneurysm, making smokers up to times more susceptible than non-smokers. It also contributes to high blood pressure, further compounding the risk. Older age is also a significant factor. As people age, calcium can build up on the aortic valve, causing it to stiffen and narrow. Aortic aneurysms are also much more common in older individuals, particularly men over or. Genetic conditions and family history play a crucial role. Certain inherited conditions, such as Marfan syndrome, Ehlers-Danlos syndrome, or Loeys-Dietz syndrome, affect the body's connective tissue, making the aorta inherently weaker and more prone to aneurysms and dissections. Even without a specific genetic disorder, a family history of aortic aneurysms or dissections significantly increases an individual's risk. High cholesterol and atherosclerosis. The buildup of fatty plaques in the arteries can lead to increased inflammation in and around the aorta, contributing to the weakening of its walls and aneurysm formation. Chronic kidney disease has been identified as a risk factor for both aortic stenosis and aneurysms. Additionally, men are generally more likely to develop aortic aneurysms than women. For aortic valve disease specifically, risk factors include congenital heart defects, such as being born with an aortic valve that has an abnormal number of cusps, like a bicuspid valve, 2 instead of the usual 3, which significantly increases the risk of valve disease. Rheumatic fever, a serious complication of untreated strep throat, can cause damage and scar tissue on the heart valves, leading to narrowing or leakage. Endocarditis, a life-threatening infection of the heart's inner lining and valves, can directly damage the aortic valve. A history of radiation therapy to the chest for certain cancers can also lead to heart valve damage many years later. For aortic aneurysms and dissections, severe physical trauma such as from a car accident can directly injure the aorta and cause a dissection. Wearing a seatbelt is a simple yet critical preventive measure. Inflamed arteries, vasculitis, refers to certain inflammatory diseases that can cause the body's blood vessels, including the aorta, to become inflamed and weakened. Poor diet and lack of regular exercise, particularly diets high in fat and sugar, combined with a sedentary lifestyle, contribute to other risk factors like high blood pressure and obesity, indirectly increasing aortic aneurysm risk. Finally, drug abuse, such as with cocaine and methamphetamines, can cause sudden extreme spikes in blood pressure, which are known triggers for aortic dissection. Heavy weightlifting can also dangerously elevate blood pressure. The consistent recurrence of high blood pressure, smoking, high cholesterol, and obesity across all major categories of aortic disease indicates that many of these conditions stem from a shared set of modifiable cardiovascular risk factors. This suggests that aortic disease is often not an isolated issue, but rather a manifestation of broader systemic cardiovascular health problems. This implies that widespread public health initiatives targeting these common risk factors could have a significant synergistic impact on reducing the overall burden of aortic disease. Recognizing the signs, symptoms to watch for. It is crucial to understand that many aortic aneurysms are often asymptomatic, meaning they develop slowly and cause no noticeable symptoms until they grow very large, begin to press on nearby organs, or, most dangerously, rupture. This characteristic is why aneurysms are sometimes referred to as silent killers. When the aortic valve is affected, symptoms typically arise as the condition progresses. These can include chest pain or tightness, a feeling of dizziness or lightheadedness, fainting spells, fatigue, especially after physical activity or reduced ability to be active, shortness of breath, particularly during vigorous activity or when lying down, and sensations of a pounding or irregular heartbeat. In children, aortic valve stenosis might manifest as not eating enough or not gaining sufficient weight. Sometimes, the very first signs of aortic valve disease are related to the development of heart failure. If an aneurysm begins to expand or leak, symptoms can emerge. For an abdominal aortic aneurysm, AAA, this might involve a throbbing sensation in the abdomen, deep pain in the back or side, or a steady gnawing abdominal pain that persists for hours or days. For a thoracic aortic aneurysm, TAA, symptoms can include pain in the jaw, neck, back, or chest, unexplained coughing or hoarseness, and difficulty breathing or swallowing. Signs of a ruptured aneurysm are a life-threatening medical emergency requiring immediate urgent care. Symptoms include sudden, severe pain in the lower abdomen and back, for AAA, or sharp, sudden pain in the chest and upper back that may move into the abdomen or arms, for TAA. Other critical signs include nausea, vomiting, clammy and sweaty skin, feeling lightheaded, a rapid heart rate upon standing, or signs of shock. An aortic dissection typically has an abrupt and sudden onset, often without any prior warning signs. The most characteristic symptom is sudden, severe, sharp, or stabbing pain, frequently described as a tearing or ripping sensation. This pain can be felt in the chest, back, neck, jaw, or abdomen. Other symptoms may include fainting, difficulty breathing, sudden weakness or numbness, paralysis on one side of the face, dilated pupils, vision changes or double vision, stiff neck, sensitivity to light, seizures, or loss of consciousness. Due to symptom similarity, an aortic dissection can sometimes be mistaken for a heart attack. It cannot be stressed enough that aortic aneurysms and dissections are life-threatening medical emergencies. If an individual experiences any sudden, severe pain in the chest, back, or abdomen, or other concerning symptoms like fainting or difficulty breathing, it is imperative to call emergency services immediately. Delaying care can have catastrophic consequences, with type A aortic dissection having a mortality rate of % per hour without surgery. The fact that aneurysms are often silent until critical and dissections strike abruptly without warning is a crucial reality. This means that relying solely on the presence of symptoms for detection is inherently risky, highlighting the need for proactive screening for at-risk individuals. Diagnosis: how doctors uncover aortic disease. When an individual visits a healthcare professional with concerns, they will start by examining the patient and asking detailed questions about their symptoms and medical history. During this examination, a doctor might detect a heart murmur, a whooshing sound heard through a stethoscope, which can be a sign of aortic valve disease. For abdominal aneurysms, a doctor might sometimes feel a pulsating sensation in the abdomen or hear rushing blood flow with a stethoscope. The crucial role of imaging tests cannot be overstated. Many types of aortic disease, particularly aneurysms, are often discovered incidentally during imaging tests performed for other health conditions. However, when aortic disease is suspected, rapid and accurate diagnosis through specialized imaging is paramount, especially for aortic dissection, where every hour counts. An echocardiogram is a non-invasive test that uses sound waves to create live pictures of the beating heart, showing how blood flows through the heart chambers and valves. It is excellent for assessing the severity of aortic valve disease. A transesophageal echocardiogram, TEE, in which a small ultrasound device is guided down the throat, provides even more detailed images from inside the body. A cardiac CT scan uses a series of X-rays to generate detailed cross-sectional images of the heart and aorta. It is invaluable for measuring the size of the aorta, closely examining the aortic valve, and quantifying calcium buildup. A cardiac MRI uses powerful magnetic fields and radio waves to produce highly detailed pictures of the heart and aorta, helping determine the severity of valve disease and measure aortic size. A magnetic resonance angiogram, MRA, specifically visualizes blood flow. A chest X-ray is a basic imaging test that can show the condition of the heart and lungs, and can indicate if the heart is enlarged, which might be a sign of certain aortic valve diseases or heart failure. An electrocardiogram, ECG or EKG, is a quick test that records the electrical activity of the heart, showing its rhythm and rate. Exercise tests or stress tests, often involving walking on a treadmill or riding a stationary bike while an ECG or echocardiogram is performed, assess how the heart reacts to physical activity and whether valve disease symptoms emerge during exertion. For those unable to exercise, medication can be used to simulate the effects of exercise on the heart. Finally, cardiac catheterization, while not a primary diagnostic tool for aortic valve disease, may be used to assess its severity or diagnose the condition if other tests are inconclusive, providing detailed insights into blood flow and heart function. The ability to diagnose aortic disease early, often before severe symptoms appear, is critical for preventing life-threatening complications like rupture or dissection. For this reason, doctors may recommend routine screening for individuals at higher risk, such as men age 2 who have a history of smoking, or men and women in the same age group with a family history of aneurysms. The recurring theme that many aortic conditions are silent until a crisis and are often discovered incidentally or through targeted screening indicates a shift in diagnosis from a reactive, symptom-driven approach to a proactive, risk-stratified screening model. The value of imaging tests extends beyond mere confirmation of symptoms. They become tools for early detection in asymptomatic, high-risk populations. Prevention and management, taking control of your aortic health. Many aortic conditions are influenced by lifestyle, making proactive health choices incredibly powerful for both preventing disease and managing existing conditions. Monitoring and controlling blood pressure is arguably the single most crucial step. Chronic, uncontrolled high blood pressure is a primary factor in weakening the aorta's layers, increasing the risk of both aortic dissection and aneurysm. Regular blood pressure screenings are essential, and using a digital blood pressure cuff at home can help monitor readings. If diagnosed with chronic high blood pressure or hypertension, a doctor may prescribe medication, which must be taken exactly as prescribed. Quitting smoking is considered the most important modifiable risk factor. Quitting smoking can dramatically reduce the risk of developing an aortic aneurysm and improve overall cardiovascular health. If an individual smokes, seeking support from healthcare professionals or cessation programs is advisable. Maintaining a healthy weight and adopting a heart-healthy diet are also vital. Obesity is linked to increased blood pressure, a key risk factor. A balanced, nutritious diet rich in fruits, vegetables, lean proteins, poultry, fish, whole grains, and low-fat dairy is recommended. It is important to avoid saturated and trans fats and limit excess salt and sugar intake, as high sodium can directly raise blood pressure. Regular physical activity is an integral part of prevention. Individuals should aim for at least minutes of moderate physical activity most days of the week. Regular exercise helps reduce blood pressure and contributes to overall heart health. Always consult a healthcare team before starting any new exercise routine. Managing emotional stress is also beneficial for the cardiovascular system. Finding healthy ways to reduce stress, such as through exercise, mindfulness practices, or connecting with support groups, is advantageous for heart and overall well-being. A simple but critical preventive measure is wearing a seatbelt every time one rides in a car, which helps protect the chest from trauma that could lead to an aortic dissection. Regarding medical management and surveillance, beyond blood pressure control, medications can help manage conditions like high cholesterol, reducing the pressure on blood vessel walls and lowering the chance that an aneurysm will rupture. Consistent doctor visits are vital. For individuals diagnosed with aortic disease, even if it is small and asymptomatic, a diligent surveillance program involving regular imaging tests like CT scans is crucial to monitor the aorta's stability and growth over time. This fosters a long-term relationship with the care team. If there is a strong family history of aortic disease, genetic testing may be a valuable screening option to understand inherited risk. When aortic disease progresses or becomes critical, medical intervention becomes necessary. The specific treatment depends on factors like age, overall health, and the size, type, location, and growth rate of the aneurysm or valve issue. For small aneurysms that are not causing symptoms, doctors may recommend a watch and wait approach with close monitoring through regular checkups and imaging tests. If an aneurysm is large or growing rapidly, or if an aortic dissection occurs, surgery is often the best course of action. This can include traditional open surgery, where the damaged section of the aorta is replaced with a synthetic graft. Less invasive endovascular aneurysm repair, EVER, or thoracic endovascular repair, TEVR, involves guiding a stent graft through blood vessels to reinforce the aorta from within. More complex cases might require fenestrated endovascular repair, fever, or a hybrid approach combining open and endovascular techniques. For Stanford type A aortic dissection, emergency open chest surgery is typically required due to its immediate life-threatening nature. The evidence indicates that lifestyle changes and medical management are not solely about preventing the onset of aortic disease, but are also crucial for managing existing conditions and slowing their progression. This reveals that prevention and treatment are not separate silos, but rather a continuous spectrum of care. Proactive lifestyle choices and consistent medical surveillance can significantly reduce the likelihood of needing emergency, high-risk surgical interventions. Conclusion: empowering your health journey. This report has explored the vital role of the aorta, the main types of aortic disease, from valve issues like stenosis and regurgitation to dangerous vessel wall conditions like aneurysms and dissections. It has identified the key risk factors, especially the powerful influence of lifestyle choices such as managing blood pressure and quitting smoking. And it has demonstrated that while some conditions can be silent, recognizing symptoms and seeking immediate care for emergencies is paramount. Individual aortic health is largely within one's control. Adopting a heart-healthy lifestyle, including a balanced diet, regular exercise, and stress management, is strongly encouraged. Most importantly, it is crucial to discuss personal and family medical history with a healthcare professional. Inquire about risk factors and ask if routine screenings are appropriate. Early detection can be life-saving. If sudden severe chest, back, or abdominal pain, or other concerning symptoms are experienced, immediate emergency medical attention should be sought without hesitation. To learn more about cardiovascular health and how to protect your heart, check out the US Health Guide YouTube channel for useful and reliable information. Staying informed and vigilant empowers individuals on their health journey.